Hey everyone, it's me again, and today I'm just going to be giving you a quick background on COVID, how it works, how it spreads, and how you can minimize your risk of getting infected. So the coronavirus is an infectious disease that is caused by the SARS-CoV-2 virus, and most people who will fall sick with it will only have mild to moderate symptoms, but there will be some who become seriously ill and will require medical attention. Those who have mild to moderate symptoms will generally recover by themselves without any special treatment, just using over-the-counter medication, and that'll generally be about 80% of the people who contract COVID. So I do just want to mention now, because I'm going to be glancing to the side a lot. Again, I am using notes because I do not want to give any false information. I want to make sure that the information I researched is exactly what I'm telling you. I don't want to be giving anything out of my head. So everything that I'm saying to you, I have written on a piece of paper that I have sat next to me. So now we are going to talk about how it spreads. It will spread from an infected person's mouth or nose in small liquid particles when they cough, sneeze, speak, sing, or even breathe. So if you're infected with COVID and you breathe, you can transfer the virus to someone else. So these droplets can range from large droplets, like that you'll see when you sneeze on a surface and you see droplets, to small aerosols, which is, for example, you can see the aerosol when you are outside on a really cold day and you breathe and you see your cloud of water vapor leaving your mouth, that kind of aerosol. So you will be infected by breathing in this virus or by touching a contaminated surface, and then your eyes, nose, or mouth. Any part of your body that has a mucous membrane. So basically any part of your body that is internally wet. So the inside of your nose has a mucous membrane. The inside of your mouth has a mucous membrane. Your eyes have mucous membranes. Anywhere where the virus can come into contact with your blood, basically. It can get into your blood or through your mouth. So it will then spread much more easily indoors and in crowded environments because there's nowhere for the virus to escape. If you're inside with your windows closed, you're going to be circulating the virus inside. If you're in large crowds, you're more likely to come into contact with someone who has COVID. So there are people who have underlying risk factors or comorbidities, as they are called in the medical terminology, I suppose. These are people who are more likely to become seriously ill if they contract COVID because they have other risk factors that already make them ill. So the people who are more likely to get seriously ill are the elderly, patients with cardiac problems or respiratory problems, so lung disease or heart diseases, obesity, being overweight, a weak immune system, so anyone who's gone through chemotherapy can also have a weak immune system, anyone with immunodeficiency, anything like that, diabetes, and even people with a high blood pressure. So if you have any of these comorbidities, you are much more likely to get seriously ill if you do contract the virus. Finally, I'm just going to talk quickly about how you can minimize the risk of infection, so how you can prevent yourself to the best of your ability from getting infected with COVID. So the virus is susceptible to common antibacterial cleaning agents such as bleach or any alcohol-based cleaners, but the alcohol-based cleaners need to have 70% alcohol. Make sure when you are buying sanitizer or a cleaning agent that says it has alcohol in it, that it has at least 70% alcohol, because that is what is required basically to kill the infection. The virus, excuse me. So you can regularly and thoroughly clean your hands with an alcohol-based hand rub or wash them with soap and water for at least 20 seconds. Now what I've done is I've gone and found a chorus of a song that I really enjoy that lasts 20 seconds. So every time I wash my hands or I put rubbing alcohol on them, I sing the chorus of that song, and I know that once I finish it, 20 seconds has gone by and I've cleaned it to the best of my ability. I've cleaned my hands. So that is a good tip if you maybe struggle to count 1, 2, 3 while you're washing your hands. Very boring. Alright, so then you must maintain at least 1 meter distance, at least. I would say 1.5, but at least 1 meter distance between yourself and others, regardless of whether or not they have COVID, because to be honest, you don't know. You don't know. Anyone in the street could have COVID and you would have no idea. Finally, avoid touching your face or your face mask with unclean hands. Now, an issue that we are seeing a lot is that people will take their hand that is dirty, might have the virus on it, hold their mask, pull it down, and then put it back up, just so you can inhale whatever they've just put on the mask. So if you are giving a mask to someone, if you're taking your mask off, hold it by the strings that go around your ears or around the back of your neck, because those parts will not come into contact with your mouth, your nose, or your eyes, and that'll give you less chance of infecting yourself by touching a contaminated surface. Have a great day, and I hope that this video was informative.